Hi and welcome to your video on induction. We're going to cover due date, natural induction techniques, and what is actual induction of labour when you go into the labour ward, or the induction ward is what it's called in most hospitals. Before we begin, I want to read the NICE guidelines, and there's NICE guidelines on everything, not just labour and birth related, but to do with all of healthcare. And it's the National Institute for Clinical Excellence guidelines. And these are the things that nationally should, and I say should, but they're not always immediately offered to all women and mothers. And so this is talking from a labour perspective. So they say induction of labour has a large impact on the birth experience of women and their babies, and so needs to be clinically justified. So there needs to be a reason of why they're inducing you. It may be less efficient and is usually more painful than spontaneous labour. Epidural anaesthesia and assisted delivery are more likely to be needed if labour has been induced. More likely, but it's not always the case, and I would like to say I am an advocate for positive inductions, and it's not all negative coming from me. What I will say is the guidelines are changing, and there's a lot of petitions going around at the moment which I have signed and have shared on my social media, because they're trying to reduce it from 42 weeks at the moment to all mothers being offered an induction, and probably quite persuaded to have an induction at 41 weeks. And you know, like a normal gestation period can go all the way up to 43 weeks at least, you know. Already in France, I think they're 43 or they're 41, I've got it completely confused. Anyway, not important. So what is a due date? Well, a due date is based on the date of your last period and then worked forwards from like the cycles of the moon. It's kind of a fallacy, okay? It's this magical date on which apparently all babies should be coming out. It's like looking at an apple tree covered in apples and going, well, on the 3rd of June, all these apples are going to fall down from the tree perfectly right at exactly the same time. And it's just not how nature works. Also, if you think about the lengths of our monthly cycles, like I have a 27-day cycle. Maybe at some points in my life it's been 30, 28, and everybody can be quite different. So the length of your personal cycle is going to affect the length of your gestation period as well. So this magical date, this date that they base an awful lot, they put a lot of power in this day, is really just plucked out of thin air, pretty much like that, okay? So induction for post dates, in my mind, this is my biased opinion, I wouldn't go for it, okay? There are many medical conditions, which means induction of labour is the safest thing to do. And for some women, post dates, they are most happy knowing that they can go and be offered an induction. So for them, it's definitely, they're all in for it. So I'm saying that my biased opinion, I don't really agree with induction just because you've gone over your magical date, unless there's another reason. If you want to read a fantastic book, Dr. Sarah Wickham has a book called Inducing Labour. I don't have it handy, it's in my little studio, but I can recommend that, and it has all the statistics and gives you all the numbers and a very unbiased look at all the different reasons you may be offered an induction and the pros and cons, the risks and benefits of all of them. And so I highly recommend that if it interests you. So what are these natural induction techniques? So there's a whole list here, and obviously we know you could go and eat a hot curry, you can eat pineapple. Gosh, you'd have to eat about 3 pineapples to get the magical like chemical that they say is going to work. It's similar to prostaglandins that you find in semen. There's raspberry leaf tea, you can get that in capsules. That's meant to soften the cervix, start softening it, encouraging everything to go ahead. I've got a few friends that swear by those. Things that have actually been researched to really help is nipple stimulation. So sex, nipple stimulation, clitoral stimulation are all things that can help you. I mean, they're going to make you feel relaxed and happy, I'm sure, but they can help to increase the oxytocin in your body to encourage birth to start. Or if you are going in for, a hospital induction, it may mean there's more oxytocin in you to help when things started less naturally. Also dates. There was a study done, if you eat 6 dates a day towards the end of your pregnancy, it has been shown to bring on labour close to the due date, but it was just one quite small study. So there you go. And laughter, so watching lots of comedy things. For me, I think the most important thing is to relax. And this can be really hard when we're talking about the due date and And a midwife and people all in that clinical setting putting so much power on that date, and even people around you. And I always say, don't tell people your due date, tell them a due month, and go over like by about 4 weeks. Otherwise, as you get close to it, you're getting so many texts like, oh, how are you? Or have you had a baby yet? And it can cause this sort of low level stress in you. And at the same time, the midwife's wanting to book in the sweeps, they want to book in the induction before the day even gets there. This is this low-lying stress. So the more you can relax and trust your body, listen to a relaxation, listen to the meditation scripts I send you, or any guided meditation online, or just go and do whatever makes you feel relaxed and happy. Probably not thinking about when your beautiful baby's going to come is sometimes the most useful thing to do. So relax and laugh. Relax and laugh. That's my top natural induction techniques. Okay, so now we're getting on to what is induction. To begin with, it's simply a stretch and a sweep. And so this is something you can have at your GP surgery, at a birth centre, wherever you're seeing your midwife. And that would be the midwife inserting 2 fingers, I would say at least 2 fingers, up into the vagina, right up to the cervix. So they have to go up quite a long way, depending on where your cervix is sitting. And then moving them around the cervix. So you're just trying to agitate the membranes to say, right, come on, we're getting ready. They can also check if the cervix is tucked up underneath, and they might pull it forwards, or it might already be forwards and feeling quite soft, in which case they can give you a Bishop score. Again, this is a bit like a snapshot in time. So at that moment, that's where you are. It can obviously change as soon as you leave. And just that action of putting the hands inside of you, it's a little bit weird and stressful. So, the cervix may have been soft, it may retreat a little bit. So it's not a very accurate score to go by, but you're welcome to ask them. So a stretch and a sweep, you can have quite a few of these. I don't know if there's like a guideline on the number. I know friends that have had maybe 3 or 4 and then they gone into labor, friends that have had 1, people that will not have them, whatever, they want to wait. And so it's a personal preference. It is sort of the first step in induction. It doesn't have to lead into full induction on an induction ward, and that's important to note. This is just something that's probably the least invasive that can be done by the midwife, and then you can go home after that and wait and see if anything happens. So after that, you will be booked in for a medical induction. This will be in an induction ward, probably connected to a labour ward in a hospital. It won't be at a birth centre. You'll go in, they're going to do a stretch and sweep first because they're going to see if anything's happening. Maybe you're already 1 centimetre, 2 centimetre dilated, just there's no surges happening within your body at that moment. After that, they're going to put in some prostaglandin gel, or usually something that looks a little bit like a tampon but much smaller. So they'll put something in with the prostaglandins in, and this is the hormone that's released to get the cervix softening and get things moving along. Well, one of them. So they'll put that in and they're going to wait for a number of hours, 6 to 12 hours. If nothing happens, then they're going to do another one of those. So now you're noticing there's probably quite a long timeline in this induction, and you can be offered induction as this is like life or death. You need to be induced for the sake of yours and your baby's life. And in some case, maybe that's true, but if you're being booked in for an induction like this, as soon as you get in, they will say it could take up to 5 days. So you've got a couple of days at the beginning where you're having your stretch and sweep, you're having the prostaglandin inserted into you, and then just waiting to see. So if nothing happens after the first 2 attempts, then they're going to go for artificial rupture of membrane. So they're going to break the waters for you. This is painless. They'll put a little plastic hook up inside, they'll rupture the membrane, the water comes out. This can make labour start immediately and incredibly intensely. Woohoo, you say. It might be a little bit intense. Or again, it could do nothing. Think about those apples on the tree. If your body's 2 weeks away from being ready, then it's unlikely that doing these things is going to get it going, because it's like, I've not finished cooking the baby. Okay, the baby will be fine when they come out, more than likely, but the body is not ready and raring to go. So it could do a lot, or it could do absolutely nothing. If nothing happens, they're going to leave it to wait again for another number of hours. And then you'll be offered the drip, the synthetic oxytocin drip. So the Syntocin on drip. When you go on the drip, this will start labour. I would say in 99% of cases. That's not an exact statistic, but it will get things going, and it will get things going quick. And so that's usually when you're offered an epidural, because you're going from you haven't had any of the more sort of gentle surges which usually begin in the early labour, and you're going bam straight in. So the body and all your systems haven't had a chance to adjust. It's also because it's synthetic oxytocin, it's not absorbed in the same way into your body, so it's not activating the endorphins to be released. Like our natural oxytocin, when that's released, the endorphins are released, so we have those really powerful natural painkillers. So for some people it is very intense. For others, it's not, okay? I have a really good friend who said she wasn't even in that much discomfort. So it, again, will be dependent on you and your body and your pain threshold personally. So you may want to consider an epidural at that point, or have that in your mind as if it gets to that stage, would I like one? Would I like to wait and see, what your thoughts are before you get to that point. I'll do a separate video on pain relief options after this anyway. So once that all gets going, then you're going to have a timeline of how long birth should take. And so again, if the drip has not got things progressing enough, then you may be offered things like forceps, ventouse, or a cesarean birth. So these are the assisted methods that can be more prevalent after induction, but not in all cases. So I would go into it with your heart open, your eyes open, knowing what your options are, and see what your birth has in store for you, whether it's naturally induced, medically induced, or it starts completely unassisted on its own. Please listen to this video back if you need to, and ask me any questions. You can ask them at the beginning of the class, or send them to me on an email right after you've watched this video. And I'll see you soon.